complementary and alternative medicine in children. So, first we have to see whether the conventional care is being abandoned, or if the condition is life threatening, then we have to involve child protective services or get court order to give the treatment to the patient and uh, avoid the alternative medicine. And if the conventional care is being given to the patient, so we have to see whether the conventional care is being delayed due to CAM. If it is being delayed, then alternative therapy should be discouraged. If it is not being delayed, and then we have to see if CAM is known to be ineffective or unsafe. If it is known to be unsafe or ineffective, it should be discouraged. If it is safe, and then it can be given and tolerated, and patient should be monitored closely. Then herbal medications. The first herbal medication is motherwort. Motherwort, dangerous to the mother. So it can cause miscarriage, and use with caution in patients taking sedatives or cardiac medications. So two things to be remembered is it can cause miscarriage, motherwort, and to be used in caution in patients with sedatives or cardiac meds. And the other thing is what it is used for. It is used to calm the patient in anxiety, insomnia. It also calms CVS, so used in certain states like tachycardia and hypertension, and it helps regulate menses as well. The next thing is black cohosh. Black cohosh is used to alleviate the symptoms of postmenopausal like hot flashes and vaginal dryness, and the side effects include increased estrogen side effects, and also hepatic injury, and estrogen can cause hypertension. Then the third thing is St. John's wort. St. John's wort, the use is in depression and insomnia. There is no evidence, but it is used for by patients of depression and insomnia. It can cause drug interaction with the antidepressant and cause serotonin syndrome. And with oral contraceptives, it can decrease INR, and with digoxin as well. St. John's wort is a SIP, interacts with the cytochrome P450 system, and thus it interacts with these medications. The side effects are general GI disturbance, nausea, vomiting, fatigue, photosensitivity, and it can also cause hypertensive crisis like with antidepressant, serotonin syndrome, hypertensive crisis. Now there are Korean herbs, ginkgo biloba and ginseng. The use of these medication is in memory enhancement or mental performance. The side effect of these Korean medication is increased bleeding risk. So it should be used with caution. In surgery candidates, it should not be used, and also not given in people with taking aspirins or other antiplatelet drugs. Saw palmetto. You can learn like saw performance, saw blood. So saw performance means it helps in performance, like where testosterone is low, so it is used in hair loss or in to help prostate support by decreasing prostate size. So it is used in BPH. There is no evidence, but saw palmetto is used in BPH, saw performance. And saw blood, so the contradiction is bleeding. So caution in surgery candidates, and also not given in people taking aspirin or other antiplatelet drugs. And it can also cause liver disease, cholestatic hepatitis or pancreatitis, and general GI discomfort. Kava kava is kala kala. Kava kava kala kala. Kala kala means black. So these black pills decrease anxiety or insomnia and are dangerous for the liver. Use is in anxiety or insomnia, and side effect is liver toxicity. Licorice. Licorice is while eating. So licorice candy that we eat. So while eating it can go into GI or respiratory, and it's salty. You can remember it like that. So while eating, used in stomach ulcers or bronchitis or viral infection, and the side effect being salty, so hypokalemia. Salty means increase NaCl, but here we are doing decrease hypokalemia, just to remember. And hypertension, metabolic alkalosis. What happens is hypokalemia leads to suppression of the RAS system, so low aldosterone, low plasma renin. And licorice has a substance called glycyrrhetinic acid, which inhibits 11 beta hydroxysteroid dehydrogenase and prevents the conversion of cortisol to cortisone. So the excess cortisol binds to mineralocorticoid receptors and cause hypertension, hypokalemia, and metabolic alkalosis. It can be mistaken for primary aldosteronism because of the symptoms, but इसमें the serum aldosterone is low. Echinacea or ephedra. Uh, Echinacea first. Echinacea, we have to remember respi. So use in treatment and prevention of cold and flu, and side effect is anaphylaxis, which is more in asthmatic patients. And ephedra. Ephedra is use is in treatment of cold or flu, same like echinacea, but ephedra also causes weight loss with improved athletic performance. Side effect being hypertension, arrhythmia, or MI, so banned by the FDA. Sudden death, stroke, seizures. So ephedra, which is used by athletes, is very dangerous. Hypertension, arrhythmia, MI, sudden death, stroke. Glucosamine or chondroitin used for osteochondritis, and aristolochic acid you found in Chinese weight loss herbal med. Side effect is nephrotoxicity.